Hi viewers, welcome back to my YouTube channel. So today I am going to show you the technique of how to do a simple interrupting suturing. So for this we need a suturing mat which is or which resembles a normal human skin because it consists of epidermis and a layer of dermis and hypodermis and multiple lacerations for better practice. I ordered this suturing practice kit from the RAS, and I am highly satisfied with this product because it consists of all the accessories, surgical equipments used for suturing. So first of all, we have a curved artery forceps. Beside this, we have a scissor, and along with this is the straight artery forceps used for clumping or holding the arteries during bleeding or to hold the needle. And this is tissue holding forceps used to hold the epidermis or the dermis during surgical procedures. And along with this, we have a scalpel holder used for holding this scalpel, that is the surgical blade. So I have unfortunately broken the scalpel, so you should have to compromise. Otherwise, I must have told you the technique to insert the scalpel into the scalpel holder. And apart from this, the main important thing is the surgical thread or suturing thread, which is silk braided. Mostly silk braided threads are used for surgical procedures involving the epidermis or the skin. Now let me tell you the procedure. So for this, hold the needle in your left hand and the artery forceps in your right hand. Grasp the needle from 2/3 of its tip with the artery forceps and lock it by this mechanism or by this way. Now to perform the interrupted suture, you need to begin by threading the suture material through the needle holder and inserting the needle into the tissues on one side of the wound. But with the help of tissue holding forceps, just have a look into the wound and its depth. So pass or insert the needle from one side and take it out from the other side like this. Take out all the thread except the finishing 1/3 of the thread, so in order to make a loop and to give a surgical knot. Yes, you have heard it correctly. I said surgical knot. Surgical knot is not like a simple knot you give at home. It is like twisting or rolling the thread upon the artery forceps twice and then grasping the end point of the thread. And keep in mind that always give 2 to 3 knots, otherwise the wound will not close properly and the stitch loses its tensile strength. And to assure a beautiful symmetry, always give the knots on one side of the wound and make sure to keep the tension even and the stitches evenly spaced. Now take the scissors or blade and cut the both ends of the thread like this. Now again perform all the steps in a similar manner as you have performed it previously. Insert the needle on one side of the wound and take it on the other side like this. Take out all the rope, leaving behind a little bit end, and give again the same type of knots as previously, and must maintain the inter-suture distance in order to have a beautiful outlook. And as you all know that the interrupted suture technique is a versatile and reliable method for closing wounds, and with practice you will become proficient in its use. Remember to always prioritize precision, control and patience when performing this technique, and you will achieve excellent results.